Welcome back to Minority Med Project, where we discuss minority health, representation in medicine, and the issues shaping healthcare in our communities. Today, we're taking a deep dive into an issue that sits right at the intersection of public health, geography, and social justice: asthma and environmental health. Asthma is a chronic condition that causes the airways in the lungs to swell and narrow, making it difficult to breathe. It could trigger coughing, wheezing, and shortness of breath. While asthma can affect anyone, the air we breathe is far from equal. In the United States, asthma disproportionately impacts Black, Hispanic, and Indigenous communities, leading to high rates of emergency room visits, hospitalization, and even preventable deaths. To understand why this disparity is so stark, we have to look closely at environmental justice and a concept known as redlining. Historically, redlining was a discriminatory practice where banks and government entities drew red lines on maps around minority neighborhoods, denying them loans, investments, and resources. Decades later, the fiscal consequences of those maps remain built directly into our infrastructure. The targeted communities were far more likely to be selected as sites for major highways, industrial factories, chemical plants, and waste facilities. As a result, low-income and minority communities are routinely exposed to significantly higher concentrations of ambient air pollution, diesel exhaust, and particulate matter. Living near busy highways or industrial zones means inhaling fine particles every single day that directly irritate delicate lung tissue, triggering severe asthma attacks and worsening long-term lung function. The environmental burden doesn't stop outdoors. Indoor environments play a role in respiratory health as well. Due to, due to systemic housing inequities, minority families are more likely to live in older, poorly maintained housing units. These environments frequently suffer from substandard ventilation, mold growth, infestations, and gas stove emissions, all of which are potent, well-documented asthma triggers. When families lack the financial resources to remediate mold or replace outdated heating and cooling systems, their homes become constant sources of exposure. Furthermore, climate change is rapidly intensifying these disparities. Rising temperatures increase ground-level ozone pollution and lengthen pollen seasons, creating longer and more intense trigger periods for anyone living with chronic respiratory condition. Urban areas with fewer trees and more concrete, often referred to as heat islands, trap both heat and toxic air pollution, creating severe health risks for the residents who live there. The gap in asthma outcomes is also compounded by barriers within the healthcare system as well. Effective asthma management relies heavily on consistent access to preventative medications, like daily inhaled corticosteroids, as well as regular checkups with specialists. However, gaps in health insurance, high prescription costs, and limited access to transportation means that many patients in underserved communities are forced to rely on emergency rooms for acute crisis care rather than receiving proactive preventative medicine and maintenance. The good news is that solutions exist and advocacy is growing. Addressing environmental health disparities requires bold structural action. It means enforcing stricter environmental regulations on industrial polluters, investing in green urban infrastructure like parks and urban greens and historic heat islands, and passing housing policies that guarantee safe, healthy living conditions for low-income families. At the clinical level, expanding community health worker programs and ensuring affordable access to daily preventative asthma medications can dramatically reduce emergency room visits. Clean air should never be a luxury determined by your zip code. Protecting the lungs of our community starts with recognizing that environmental health is a fundamental right. Thank you for listening to our Minority Med Project. Join us next time as we continue exploring the topics that shape minority health and the future of medicine. This is Minority Med Project, educating, uplifting, and inspiring.